Hello everyone, I'm Dr. Punkage, and this is my mom, Dr. Tacker.
Hello.
We own Peekaboo Pediatrics, and today we'd like to talk about Texas health steps based on questions we hear from our patients.
Thanks for joining us today, and let's get started. Texas Health Steps offers children with Medicaid no-cost medical checkups starting at birth and no-cost dental checkups starting at 6 months of age.
Pediatricians like us do medical checkups for kids from the day they're born up through 20 years of age. Checkups are so important because they can help us find health problems before they get worse and harder to treat.
They can help us help you keep your children healthy, happy, safe, and well-nourished.
Overall, one of the most important things we do for any age group is to track children's growth and development. Things like height and weight and whether they're walking and talking as we would expect them to, and whether they are alert and happy and enjoying the foods that are right for their age.
These are very good signs that all is well, and if we notice something that doesn't seem to be on track, that gives us a chance to see if there is something we can do to help before it becomes more serious. Texas Health Steps checkups happen at different times for different ages. For newborns and infants, the checkups are more often. We'll see babies within 5 days of birth, then at 2 weeks, and then every 2 months, and then every 3 months, and then every 6 months until they are 3 years old.
Once your child turns 3, the checkups are just once a year. There's a schedule you can print or view online to make it easy to keep up with the recommended visits, or your doctor can give you one. For a newborn, for example, we check your baby's eyes and hearing, see how they react to faces and bright objects, and how they respond to sounds.
And we'll check the baby's reflexes and look at the screening tests that were done at the hospital. It is our chance to get to know your baby, which is also important.
For a 9-year-old, a checkup would cover all the physical basics like height, weight, blood pressure, hearing, vision, and making sure all immunizations are up to date.
But we might also begin watching for signs of puberty and giving your child the opportunity to ask questions about any changes they're noticing in their body.
And for a teenager, in addition to providing a physical exam and updating immunizations, we might talk about making sure they're getting enough physical activity and enough sleep.
At that age, a child needs 8 to 10 hours of sleep per night to perform well at school and sports.
That's right, 8 to 10 hours. It's not easy, but teenagers really need it. Vaccines are also a big part of these scheduled checkups, and we feel very strongly about that.
I'm old enough to know firsthand just how important this is. In my country, India, where I received my medical degree, I saw children suffering from diseases like smallpox, diphtheria, whooping cough, and many other contagious diseases that could have been avoided if vaccines were available.
So please, just do it. Protect your kids. Keep their immunizations up to date. Your pediatrician can work with you to stay on top of this.
We understand that parents may be worried about COVID-19 and tempted to put off their children's regular checkups. But you can be sure your doctors have taken steps to make sure it's safe for you to visit.
And keeping up to date with your pediatrician is so much better than waiting and finding out your child has a health issue that we could have easily taken care of early on.
Plus, we love seeing our patients grow up and live well.
Thanks for letting us share our thoughts about regular, no-cost Texas health steps. For more information, visit communityhealthchoice.org. Stay safe and take care.